What lab results impact your lactulose dosage? If you or someone you know is managing hepatic encephalopathy, understanding how lab results influence lactulose dosage is key to safe and effective treatment. Lactulose helps reduce ammonia levels in the blood by promoting bowel movements and acidifying the colon. But to do this safely, doctors closely monitor certain lab tests. First, serum electrolytes like potassium and sodium are very important. Since lactulose can cause diarrhea, it might lead to electrolyte imbalances. For example, low potassium levels or hypokalemia can make hepatic encephalopathy worse and cause muscle weakness or irregular heartbeats. High sodium levels or hypernatremia can also be problematic. If electrolyte levels become abnormal, the doctor might reduce the lactulose dose or pause treatment until levels stabilize. Next, kidney function tests such as serum creatinine and blood urea nitrogen are checked regularly. Even though lactulose isn't absorbed into the bloodstream, kidney health affects how the body handles fluids and electrolytes. If kidney function is impaired, it might be necessary to adjust lactulose dosing carefully to prevent dehydration or electrolyte disturbances. Blood ammonia levels are another important marker. Elevated ammonia is a hallmark of hepatic encephalopathy. While ammonia levels are not always used to directly set the dose of lactulose, trends in ammonia can guide therapy. If ammonia remains high despite treatment, the dose of lactulose might be increased gradually, always with caution to avoid side effects. Complete blood count tests help monitor for infections or bleeding, which are common in liver disease. Although they don't directly influence lactulose dosing, any sudden illness or infection might requiring reassessment of the treatment plan. Blood glucose levels are also important, especially in diabetic patients. Since lactulose is a sugar derivative, it can affect blood sugar control. If blood glucose becomes unstable, the doctor might adjust the dose or monitor more closely. In practice, the goal is to achieve about 2 to 3 soft, loose bowel movements each day. This indicates the medication is working without causing too much diarrhea or electrolyte imbalance. If diarrhea becomes severe or electrolyte levels drop dangerously low, the dose is reduced or temporarily stopped. Regular lab monitoring helps guide these adjustments, ensuring the patient stays safe and the treatment remains effective. Typically, initial doses start around 25 to 45 milliliters, taken orally 1 to 3 times a day. In more severe cases, higher doses or alternative methods like nasogastric tubes or enemas might be used if oral intake isn't possible. To sum up, the main lab results that impact lactulose dosing are serum potassium and sodium, kidney function tests, ammonia levels, and overall clinical status. Regular blood tests and careful monitoring are essential to balance the benefits of reducing ammonia with the risks of dehydration or electrolyte disturbances. Always consult with a healthcare professional for personalized advice and to ensure safe management of hepatic encephalopathy.